Welcome to the On the Pen podcast with your host, Dave Knapp.
Welcome to this Tuesday, August 26th edition of On the Pen, the weekly dose podcast. I'm your host, Dave Knapp, man on the Manjaro. That's why I'm here. You are on the pen. Wegovy, Saxenda, Victoza, Trulicity, Manjaro, Zepbound, Compound. That pen is what we talk about each and every week here at On the Pen. Welcome. If you're listening on the podcast, drop a 5-star rating and review. If you're listening on YouTube or watching on YouTube, make sure that you hit the subscribe button, hit the bell, and select all notifications because we've got some big news coming out this week. We're going to get into more of that on this week's episode of On the Pen, the weekly dose podcast. We're going to get into some news that we got today, some breaking news from Orforglipron, some things I think we need to be concerned about. We need to be watching with Orforglipron, some breaking news. We're going to get into how that stacks up to Viking Therapeutics VK2735. We're going to get into some news about Zepbound and cancer and the reduction thereof. There's just a ton we're going to get into, and it's a big week in the lawsuits. Now, if accessibility matters to you, especially as it relates to compounded versions of GLP-1, you're going to want to watch what's going on with these lawsuits between Eli Lilly and Novo Nordisk. They've got hundreds of lawsuits going on right now. And there's one big one that has a big hearing this week, and we're going to bring you some special information on that one as well. So we're going to get into it this week. I want to thank our sponsor who brings this podcast to us each and every week, Ro. This past week, we got some news from Ro in terms of a massive sponsorship that they started with none other than Serena Williams. You have to have been living under a rock, and I don't just mean a GLP-1 rock, an actual rock. If you missed this news about Serena Williams and her use of GLP-1 medications, basically coming out and saying, hey, she couldn't do it alone. She was fighting some broken biology, and that the use of GLP-1 medications was what she seemed to have been missing. So you can check out our sponsors at Ro because we saw what Serena saw, and that the best platform to get it from is Ro. You can visit ro.co/OTP and learn more about their Ro Body program, where patients lose 15 to 20% of their body weight in a year, coupled with lifestyle modifications and medication when appropriately prescribed. Love our partners at Ro. Check them out at ro.co/OTP. Just a great program over there. I really appreciate Ro helping us to do this podcast each and every week. So what's going on this week in terms of these lawsuits? Let's get right into it because we've got some exciting information to bring to you. So this lawsuit between Mochi Health and Eli Lilly is particularly interesting. Why is that particularly interesting compared to some of the other lawsuits that are going on? Well, I'm going to let somebody else say it for me because honestly, this is pretty exciting what our friend Sabina over at GLP Winner is doing. If you don't know Sabina and you don't know GLP Winner, let me introduce. Friends, I am super excited to introduce you to a friend of mine, a friend that I actually met last year at Obesity Week, nerding out together on all of the papers that were being dropped by Big Pharma on the new future generation of obesity medicine. This is Sabina, and Sabina runs a website called GLP Winner. You may be familiar with it. It's a pretty cool website where you can go and compare different telehealth companies, different pricing, what the community is saying about the use of the different telehealth companies. I think Sabina even herself different GLP providers each month just to have a good beat on who's doing it well. And so she's got a pretty good, cool company, but she's also one of those just GLP nerds, one of the few people in a very handful of people that really gets as excited about this stuff as I do. And Sabina's doing something cool this week. I saw this come across the TikTok page of our friend Lee Fitz-In, who does a lot of great coverage on the legal side of what goes on GLP-1. We've had him on many times on the pen. It turns out Sabina's doing something pretty cool this week as it relates to the lawsuit that Eli Lilly has against Mochi Health and some of the other telehealth companies. I want to bring Sabina in and have Sabina talk about what she's doing and how you can sort of follow along with what she's doing this week. Sabina, welcome to On the Pen for the first time.
Yeah. Hi. Thanks for having me. Excited to be here. Should I just dive into
Yeah,
the case?
yeah.
Okay, so
Yeah, go nuts.
it's the first hearing of one of the many Eli Lilly cases. There's hundreds of lawsuits out from Eli Lilly and Novo Nordisk. This is an in-person hearing about a motion to dismiss the case, meaning we could get a conclusion of the case maybe today, maybe Thursday, right? And so Eli Lilly has primarily been suing based on marketing techniques. We know they don't like compounding because they feel like it interferes and is competing with their product, but they will look for any kind of marketing thing to sue for. So we see the same thing with Mochi, whereas it's like, are they advertising Mounjaro or Zepbound, but practically most of their patients are not on those medications, and are the lines blurry? There's also questions of, what is mass compounding as a result of that? Like, are these truly personalized and customized? And then if their founder, Dr. Myra Ahmed, was portraying herself as a practicing medical doctor, and she has an MD, she has a 4-year degree, she has an MD, she never went to residency, she's not practicing. And yet they portrayed the company as doctor run, but her co-founder, I think, is a doctor. So there's that, that gray area. But it's was it misleading for her to be portraying herself as a practicing medical doctor when she wasn't practicing is a big question. And then the other big thing is corporate practice of medicine. So the allegations.
What is that? Can you lay out just for a second? What does that mean? Corporate practice of medicine? Because I've heard that bannered about a lot with a lot of these cases.
Yeah. So it's at the highest level, it's that we should not be incentivizing or forcing doctors to practice medicine in certain ways, right? So if you imagine, this isn't practically how it usually works, but if you imagine you're a doctor and you work for somebody and your boss is like, hey, we have to prescribe this, right? And so in the specific case of Mochi, the allegations are they owned a compounding pharmacy, they owned the actual and employed the actual physicians and clinicians that were prescribing, and then they also owned the telehealth software company that's running all of this.
Can I pause you right there?
Yeah.
Because this sounds eerily similar to what Eli Lilly is being accused of by members of Congress, right?
To some degree. And then I don't know, I'm sure you covered the lawsuit from the state of Texas against Eli Lilly, where they were basically incentivizing doctors to prescribe their medication by providing all these features and also Lilly drugs. Yeah, that's the allegations, right? It's interesting because what Mochi's doing, a lot of other telehealth companies are doing similar things. Mochi maybe is hitting more of the marks for marketing than other people, and it's they have a little bit more going on. So I think this is in some ways one of Eli Lilly's stronger cases potentially, because Mochi, has so much going on. It's surely one of these things is going to lead somewhere.
Sure.
But I think because this is one of the first hearings, if it goes in Mochi's favor, then it's very likely a lot of the other cases, the precedent will be set. A lot of the other cases might also go to the telehealth companies.
This might be more of a Lee question, so apologize for putting you on the spot. But yeah, so they got this laundry list of things that Eli Lilly is basically accusing Mochi Health of. Is it possible that the judge just picks a couple of things off that list and says, these things are a non-issue, but these maybe 2 or 3 things, we're going to move forward with these? Or is it an all or nothing thing?
I think that he can pick some of them as being worthwhile and forget the other one. The judge can, but I'm not sure.
Yeah,
I will say,
for
one of the big questions related to the corporate practice of medicine is that the corporate practice of medicine is enforced by the Medical Board of California, right? Which is not a party in this case.
Okay.
And there's a distinction where the California Medical Association filed an amicus brief agreeing with Eli Lilly, but that is a private organization. That's different from the medical board. That's a government agency that enforces things. So if Mochi were doing the corporate practice of medicine, why didn't the Medical Board of California step in? Since that's how
they would be the enforcing arm.
Yes. Yeah. So the big question is, can Eli Lilly, as a private entity, enforce corporate practice of medicine? So regardless of if Mochi is doing corporate practice of medicine or not, can Eli Lilly be the one that helps enforce it, right? Yeah. And then that would lead to a lot more litigation on this topic, or is it at the discretion of the Medical Board of California?
Man, that sounds like something that could end up in a higher court at some point. Having a one company going after another company trying to enforce something that's ultimately the responsibility of the state government. I think it probably gets a little convoluted too here because I believe that the Mochi is located in California, correct? But their pharmacy is located in Washington State. They probably have their certain practicing physicians in other states. So it's kind of spread out. So like it's kind of makes it a little bit intriguing too to see how the judge will sort of handle this.
Yeah, and then the pharmacy should be enforced by the state board of pharmacy, right? So there's some stuff like obviously the compounding shortage went away and everyone is like, oh, is compounding going away? Is it not? That gets enforced by the FDA. So these lawsuits are Novo Nordisk and Eli Lilly trying to find ways to enforce it.
Yeah.
And they generally are not litigating on patent because it's too high risk. Because if they litigate on patent and lose, then that means maybe the patent doesn't exist for them. Yeah. And the risk of that is billions and billions of dollars.
Yeah, I would argue that it's like they probably have a handshake that neither of them are going to do that, because at the end of the day, if tirzepatide goes down, it sets a pretty big precedent for all peptides, right? And you see, who is it? Is it Strive or Empower?
Empower is challenging the tirzepatide patent right now, and I've heard of other people who also plan on challenging the tirzepatide patent, but I don't think it's been filed yet.
Yeah, and you probably hear, it's funny because I think we hear a lot of the same things from probably a lot of the same people. But one of the things that I've been hearing quite a bit lately is that there seems to be a consensus among the legal representation of a lot of these compound pharmacies and telehealth companies that tirzepatide is the lower hanging fruit of the weaker patent, which to me sort of works against logic. Like it seems to me like a single agonist like semaglutide that actually mimics your natural hormone a lot closer than tirzepatide, which is a co-formulation working on two hormones. It seems like that would be harder to go after than semaglutide, but apparently that's not the consensus.
Yeah, that's been a surprising thing because I feel like a year ago, people weren't saying that, because I've heard semaglutide's patent has been overturned in many other countries because it's not seen as novel compared to the naturally occurring, hormone in our bodies.
Yeah. And yeah, for multiple reasons, I think, because when you go back to liraglutide, semaglutide is just kind of an evolution of liraglutide. But then you look at like if semaglutide were to get beat, their upcoming medications are all built on that same backbone of semaglutide, whereas Lilly has completely new molecules. I think that sort of bleeds into this fight that Lilly has with the FDA over getting retatrutide classified as a biologic. I think they're just looking for ways to sort of defend. I think because ultimately they know they're going to have to defend these patents. They already are with tirzepatide. But it's like if tirzepatide goes down, I don't think it would be as big of a deal for Lilly as it would be for Novo to have semaglutide go down, because they've got retatrutide and all these other molecules that are sort of independent.
Yeah. And it's also really interesting because big pharma companies tend to do things called make a patent thicket, which is where they continually get the medication approved for new indications or changes. Sometimes these are like actual indications. And, GLP-1s are amazing. They kind of have infinite indications they could get FDA approved for. Right. So it's like, can the patent, it's going to be really interesting to see how the next few years play out, because it's like, will we still allow the patent to keep being extended and extended and extended?
Yeah, I would argue that we shouldn't. And I think you probably do the same. But that will probably all take an act of the courts or an act of legislation, preferably, because again, when we talk a lot, this at On the Pen about accessibility and the cost of medications, especially the cost of medications when compared to the cost of medications around the world. And when you think about it, a lot of that stems from the patent law in the United States. I think one of the big reasons that I've heard that semaglutide patents have been defeated in other countries is other countries are just a little bit more reasonable about patent law. And they don't allow this kind of stuff to go on the way that we do in the United States. And so all very interesting conversation when it comes to the future of accessibility of medications. Like it all bleeds together, right? So I'm glad that you're covering it. Tell us about what you're doing this week and how people can follow along.
Yeah, so I'm going to the hearing and then I'm going to go live with Lee, if you know Lee Fits In, on TikTok and all socials. And he is going to go live during the hearing and I'm going to join him when I get out and talk about what's going on. Generally, you can't communicate while you're in a federal courtroom. So it will all be a surprise until I'm out, and I'll keep everybody informed what we're doing. And you can follow me on all socials. I'm Lollipop, LAWLIEPOP, except on Instagram where there's an S on the end. Yeah. But generally, I'm not in all socials, and I will keep everyone informed about how it's going. And I also do general content on accessibility. I do a little bit of news, but I don't do as much as Dave. Dave actually does the news, and I just do stories I'm interested in or stuff related to accessibility.
What I like about the news that you cover is, I mean, we're a little bit more broad spectrum here, right? Everything from new medications in the pipeline to what's going on with these lawsuits and stuff. But I think what is special about what you do is it's all related to accessibility. And so I know for a lot of people, that is the number one thing that they are looking to follow along with, because the thing that I hear all the time is like, from my cold dead hands, will you ever pry my GLP-1 medication? And so anything that sort of impacts that is a huge deal to people. So definitely worth the follow. Sorry, I didn't have that up before. I wasn't paying attention to what I was doing, but at Lollipop, make sure that you follow Sabina. We will link, if you can provide me a link to this TikTok live, I will link that in my link tree so you all can check that out. The link will be in the description notes of the podcast. But also, would you be willing to come on maybe Thursday, Friday, Saturday, sometime when you have a pocket of time to come back to On the Pen for this? There's a lot of people that go, oh, I'm not on TikTok. But would you be willing to come back to On the Pen, our YouTube channel and podcast, to share a little bit about what you learned?
Yeah, absolutely. And I think it's really interesting talking to Lee, the lawyer I'm going to do the live with. He's a trial lawyer, right? And I previously went to a case for around compounding in Fort Worth. That was the OFA, Outsourcing Facilities Association, suing the FDA around the shortage. And even though the courtroom was closed, I feel like you get so much information just seeing the vibes of like
body language and stuff.
Of like, what are the vibes? How do people feel? Does it look like they're having a good day or bad day? Do they seem prepared or do they seem flustered?
Are the Mochi people strutting out of the courtroom, or are their heads down and they're cursing under their breath? That type of thing.
Yeah.
Let me give you a pretty good vibe about how people are feeling about it. And so I think this is an important one to watch because, like you said, this will likely sort of set the tone for the other hundreds of lawsuits that are going on. And it seems like pharma has a really bad track record. At least Novo Nordisk has a really bad track record of being successful at any of these. But like you said, there's a lot of nuance, sort of a lot of things going on with Mochi. And, without getting too deep in the weeds on this, they sort of, I feel like, put a target on their back because of the way that they projected themselves once the shortages ended. And even before they ended, they're like, it isn't going to impact anything. And I mean, they may have had a leg to stand on legally. They may have just, really looked at things and said, hey, there's going to be no problem. And it seems to this point that they were correct, but how this sort of plays out will really tell the truth as to, how this all shakes out legally. And I don't think anybody really knows. So it'll be interesting to follow.
Yeah, I agree. And it's also really interesting because a lot of the evidence that Eli Lilly cites in their case is Reddit. They're just putting quotes from Reddit. And to me, it's like, is that, unless you actually have the person who wrote that in the courtroom at a certain point verifying it, is that a reliable source of truth?
Yeah, I know. Like, there's been a couple times where I've cited Reddit, but it's also been in terms of other things that I've heard. Like, I can't remember what the story was exactly, but one time I used Reddit as like a source, but because of some documents there, but it was also compared to things that I was hearing from other like reporters and everything, journalists, and people just blew it up. They're like, how can you use Reddit? And so, like, if they can use Reddit in a court of law, that'll be really, really interesting. So all good stuff. Really appreciate you coming by, Sabina. Once again, you can find her at Lollipop, L-A-W, like the word law, Lee, L-I-E-P-O-P. So Lollipop over on TikTok and Instagram. You're not on YouTube, are you?
I have a YouTube channel. I just put shorts on it. So I need to actually start doing. Yeah, same handle. I need to actually start doing real YouTube content though.
Yeah, those shorts are good here, but also people like to do this deep dive stuff. So I hope you'll come back in the next couple days after this happens. This all happens on Thursday, so we'll get together shortly thereafter as you have time, and we'll upload that here to the YouTube channel. Make sure you hit all the follow buttons, bell for notifications. Make sure you hit all notifications so you get that when it comes out, and make sure you follow Sabina wherever you get your socials. There, it's Sabina's a great follow and a great friend. Thank you for being here, Sabina. Appreciate you stopping by on the Pen.
Yeah, thanks for having me.
Sabina from GLP Winner. Hope that you enjoyed that chit chat about the big week in GLP lawsuits. We'll be bringing you a special interview with Sabina after she attends this hearing. It'll be interesting to hear what she has to say based upon some of, again, that body language, some of that stuff that you don't see in the headlines that'll come out of this. And if you want to catch her live rundown with our friend Lee, Lee Fits In, I will link that in our link tree. A little shout out for the link tree too. Something else you might want to catch while you're there is this past week, we had the pleasure of being interviewed on a podcast. This was the American Glutton podcast. Now, if you're not familiar with American Glutton, it is run by a guy named Ethan Suplee. And Ethan is a famous actor. Now, you may remember Ethan from American History X, Wolf of Wall Street. My Name is Earl. He's a gentleman who has had a highly successful career in acting, but has battled his weight his whole life. And his story is quite amazing. I've followed it for years, since long before On the Pen was a thing. So it was a real full circle moment for me to be able to have the chance to be interviewed by Ethan Suplee on his YouTube channel. So you can check that out in our link tree as well. Our link tree is just chock full of amazing links to content, to clinical trials if you want to sign up for a clinical trial that are being run for GLP-1s. And of course, all of our sponsors on this podcast, including our most recent sponsor, Shape'a. Now, if you caught my personal update a couple of days ago that I dropped on my YouTube channel, you'll know that I'm back to losing weight. Can you tell? I laid out the whole story about what I'm doing different, including cutting out alcohol completely and just some things that I've been doing to move the needle, especially in the wake of the health scare that I had earlier this year. Now, another thing that I incorporated sort of simultaneously was this numberless scale from Shape'a. The most amazing thing about this, there's a lot of things that are cool about this scale, but the coolest thing for me is that I have this weird wiring with my head. I know intellectually when I step on the scale one day and it's up 10 pounds that I didn't gain 10 pounds of fat. But if you're anything like me, that can totally derail your progress. And I don't know what it is mentally that causes that to happen, but it's as if Shape'a and this numberless scale has tapped into a sort of way to unwire or rewire the brain so that you have a healthier relationship with the scale. It is a numberless scale, so it zooms out and helps you to observe patterns in your weight and your body composition rather than that daily number of the scale. So it takes away that daily battle and you're just trying to stay within an appropriate color range. It's very cool. Check them out, myshape'a.com. You can check it out at myshape'a.com. Use the code OTP30. It's going to save you 30% off of this scale. Please make sure you check it out. I don't put the /OTP. I'm not sure that's up yet, but you can go to myshape'a.com. Use code OTP30. They're the latest sponsor for On the Pen, and you can get that link also in our link tree. Thank you to Shape'a for jumping on as a sponsor for On the Pen. Let's talk about Orforglipron. We've got some breaking news in Orforglipron. You're going to hear it here first, unless you're in our Discord, which is also linked in our link tree. Our Discord, this was shared by our friend Edward the Gator. Now, to back this up, today we received some data on Orforglipron in their phase 3 obesity trial. It's called the ATTAIN-2 trial. Orforglipron met the primary and all key secondary endpoints with compelling efficacy results and a safety profile consistent with injectable GLP-1 medications. Now, participants in this trial had obesity and overweight, or obesity with overweight and type 2 diabetes, and this population has an increased difficulty in losing weight. When you look at all the GLP-1 trials, diabetics always lose slower. And this tracks across all GLP-1 trials. But in the trial for Orforglipron, patients lost an average of 22.9 pounds or 10.5% on the highest dose of 36 milligrams. This was a 72-week trial with an A1C reduction by an average of about 1.8. Now, Lilly also announced that they intend on submitting this to the FDA for approval, which, if this happens fast enough, could mean that this calendar year we could see Orforglipron hit the market. It's more likely to hit the market in early 2026, but it could happen this year, especially all the stuff that's going on with most favored nations and the leverage that the FDA is using to help fast track some approvals for these drugs. Now, what will this drug be called when it hits the market? That's a game that we have played here at On the Pen for a couple years. We introduced you to the idea of all the different names that could have been approved for Zepbound, including Zepbound. Obviously, it includes Zepbound includes Zep, which is part of the word terzepatide, right? Well, could it be that the name for Orforglipron when it hits the market is Orfazent? This is a recent patent filed by Eli Lilly. And I believe that it was filed back April 23rd of 2024. So about a little over a year and a half ago. Orfazent, or FY, so for Orforglipron, Orfazent. This is likely to be the name of the Orforglipron. But what do you think? Do you think it could be Orforglipron, or do you think that it'll be a different name? This is again from Edward the Gator. I feel like we started a little bit of a trend on guessing what these names would be back on TikTok, going back to the early launch of Zepbound. But I believe that it could possibly be called Orfazent. That could be the brand name. Of course, it tracks with all the other horrible names for these drugs that these drug companies come up with. I don't get too particularly excited about any of the names that they come up with, but over time, we really become endearing to them because they're actually changing our lives. And I think this is just a fun thing to look at. Now, with this data on Orforglipron and with the data that we shared last week on VK2735, an oral small molecule, there's a couple things that I want you to be aware of, and I got to figure out how I'm going to attack talking about this first. The first thing I want to say is Orforglipron, is a small molecule. It's a non-peptide, so it's novel. We don't have GLP-1 receptor agonists that aren't peptides. Orforglipron or Orfazent will be the first one. Now, what does that actually mean? Well, peptides are just small, long chains of amino acids, or these chains of amino acids, basically these proteins, right? A small molecule drug is made in a totally different way and acts in the body totally differently. It's metabolized primarily by the liver, right? And so when it's metabolized in the liver, with other attempts at small molecules, we have seen some liver safety issues. In fact, with Pfizer, they completely abandoned a candidate called danuglipron. And danuglipron was started to be a twice daily. Then they saw liver signals and they moved it to once daily. And then they still saw liver signals. Now, here's what I want to warn you about. Over the last 2 weeks, I have seen multiple very popular research grade peptide companies come out with research grade Orforglipron. And here's my main concern. What we saw in the clinical trials for Orforglipron was that starting in the phase 3 trials, they really pulled back on the high dose of 45 milligrams down to 36. And you know what they traded off there? They traded off potential efficacy. And while that could be attributed to side effects, which we saw a fair amount in the Orforglipron oral trial, I also worry that part of that were fears of potential negative liver signals. In other words, liver damage that could be caused by small molecule GLP-1s. Again, we did not see that in the Orforglipron trials, but we saw that in the danuglipron trials, and this is metabolized in the liver. My big fear is that you see all over Reddit, people are using unapproved doses, using more than what was tested in the clinical trials on the peptides. Now, with the peptides, we know that it's probably pretty safe. They're testing high-dose semaglutide very safely, like very high-dose semaglutide. They're testing high-dose tirzepatide. I don't think there's as much of a concern there like there is with these small molecule drugs. So I know that there are people within the sound of my voice that are looking at Orforglipron as a potential option to explore on the research grade side, and I want you to pump your brakes on that, because I do get very concerned that people will take more than they should. There's a whole bunch of reasons why I would say run away from the research grade stuff. I know people will always comment. Feel free to tell me your own personal thoughts about that. But I do get concerned with the potential for people to overuse this medication and for these liver issues to pop up, potentially even with Orforglipron, because again, we saw this with Danuglipron. We also saw Lilly pull back on the highest dose of Orforglipron in the phase 3 trials. So 36 milligrams is the highest dose in the clinical trials. It used to be in the early trials, 45 milligrams, and they pulled it back. Now, there was a lot of dropouts in this study as well, including, again, another placebo dropout of, I believe it was around 18%. It was a pretty high dropout rate on the placebo side. And I think you continue to see that people are increasingly less willing to go an extended period of time with no treatment at all. And so I would call again for these obesity treatments to compare. Listen, there's oral semaglutide we could compare Orforglipron to. We don't need to put people on placebo for 72 weeks to go without treatment. Now, this was a type 2 diabetes trial. This Orforglipron trial was a type 2 diabetes trial. But I think the point is seen definitely in the Viking Therapeutics data that was an obesity trial that we saw earlier this week launch. I just think it's time to get rid of the placebos when there's other things that we can study. Now, Orforglipron is unique. We want to see the safety signals in the first of its kind small molecule compared to a peptide. I sort of understand that. I understand where they're coming from. But I do think these dropouts in these clinical trials are going to continue to lead to funky data and data that's hard for clinicians to parse out. So I hope that we can see some action by the FDA on these future, especially the injectable GLP-1 medications to treat obesity, that we can drop this whole placebo arm of these studies and just compare them to other treatments that we know to be safe and effective that are already on the market, so that people don't have to go an extended period of time with no treatment for their medication. Now, this was obesity or overweight with type 2 diabetes in this trial, so I get it. But again, you're seeing people being decreasingly willing to go without any sort of treatment for the duration of their treatment. So we'll get into this data on Orforglipron a little bit more in a separate video. But I wanted to break the news today to tell you that the 10.5% weight loss at the highest dose for diabetics over 72 weeks is pretty darn good for an oral medication. I think this is really good news for Lilly, and the fact that they are going to be applying this will increase accessibilities for diabetics. I hope that it launches at a very reasonable price point so that people can get access to this. But I do want people to use caution and exercise caution when looking at non-branded versions that are popping up, and be aware that the small molecules probably present a risk factor that you haven't seen with the injectable peptides so far, even the oral peptides. And so I just think people need to practice extra caution and not just jump into this stuff just for funsies. Take it seriously. Take your health seriously. There are other options available that I think would be probably more effective for most people and perhaps safer. But I'm not a medical provider. This isn't medical advice. Just giving you my 10 cents as a person who follows this stuff very, very closely. So that's what we got. I want to thank our sponsor, Claimable. This is another sponsor that jumped on. Listen, if you have lost access to your branded medication, this is a big deal. The branded versions of GLP-1s are increasingly harder to get for some people, with insurance plans dropping coverage for Zepbound. Listen, especially if you've been receiving care through a doctor and receiving the branded Zepbound, and now your insurance dropped it, 90% of all prior authorizations that are denied are never fought. And now we have Claimable out to change the game on that. Claimable, with an 80% track record of helping patients stay on their medication or reverse these insurance denials. You can check them out at getclaimable.com/OTP. They're one of our latest sponsors here. You can save 10% off their very minimal fee. And we've got big news coming from Claimable this week that's going to change the game for accessibility. And I don't mean in a way that other people throw that around. Like, this is a big deal, what Claimable is doing. So we'll hear from them later this week, but check them out, getclaimable.com/OTP. Many people have been reaching out to me. Hey, what's the name of that company again? Or, hey, some people have reached out to me to tell me directly that, hey, I didn't get my insurance denial reversed with Claimable, but I spent some time on the phone with the CEO and we talked through it and we talked about what's going on and how we can fight it. Listen, this is a company that takes accessibility very seriously, not just for GLP-1s, but all medications for all chronic diseases. They have some ones that they specialize in. Check them out and what they can help you with at getclaimable.com/OTP. Use the code OTP10 to save you 10%. That's what I got for you this week. A great rundown on some really exciting news in the world of GLP-1s. There's a lot more coming this week. It's going to be a big week in the news for GLP-1. So I hope you'll follow along, hit the like, save, and share button, hit the subscribe, the bell for notifications, because that interview with Sabina is going to be really great after the Mochi and Eli Lilly hearing. Really excited to bring you the information this week. It's going to be a good one. Thank you for being here. Thank you for being the best part of what we do here at On the Pen. I wouldn't, and shouldn't do it without you. Thank you for being here, and we will catch you on the next one.